One of the most important things a healthcare provider can do is be a real good listener. When that patient comes in, you want to try to figure out what is your job to do with this patient. Once you figure out what that is, you have to educate the patient on what their treatment options are, discuss pros and cons of each, and between the two of you decide what's best for that particular patient with that particular problem or job to do. I find that this is not really well done in the field of orthodontics. Unfortunately, what I see sometimes is more of an interest in the amount of dollars that they can generate per patient than the amount of good they can do. Here's an example. This particular patient was scheduled to have something called orthognathic surgery. And what that involves is a combination oftentimes of surgery on the maxilla, removing the maxilla from the cranium, resetting it, sectioning the mandible in two different places and either sliding it forward or back, and then stitching everything back together. This is a very invasive surgery. With braces, we're talking about $50,000 or so. And oftentimes somebody gets, an orthodontist may get a case that looks like this, which looks difficult. I think to anybody it looks difficult. And they say, gee, in order to solve the problem, the job to do is to straighten the teeth. And the only way I know how to do this, of course they don't say that, but what they learned in school is this is going to be a case that's going to have this orthognathic surgery and is going to have a lot of time invested, money invested, possible infections afterwards, possible relapse down the road. You will get a nice result at first, but will it stay? And did that patient go through too much to justify it? Well, I know a very talented orthodontist who can do a non-surgical, more traditional orthodontics for the same case. And this is what's done on the bottom. About a day or two before the patient was going to get the surgery, the patient had a second opinion with one of my favorite orthodontists, and they discussed a non-surgical option. And here is the almost finished result. As you can see, it's working out beautifully. Was the patient advised that this was an option? No. Did the oral surgeon and the other orthodontist share the idea that, hey, there's a guy in town who's really good who might be able to do a non-surgical approach that might work just as well, if not better? No. The problem with them sharing the idea that there's another orthodontist, they're going to lose the patient, the money, and the procedure. So unfortunately, at the patient's peril, they did not share this information, did not advise the patient of their other options, and went ahead and tried to do this much more aggressive, much more expensive, much more risky procedure. There have been occasions where children have died on the table from this process, from this surgery. So it certainly seems that this other option needs to be fleshed out and discussed, even if you're going to lose the patient. Here's another one. This patient was told their only option to correct this particular open bite, we call this an open bite. You can see the teeth are gorgeous, they're straight, but she has an open bite. Only way to fix it, surgery. Big time money, big time risk. Was the patient advised that there was another option? No. But on her own, she went and got a second opinion with same great orthodontist. And after 4 months, we have a result that's pretty much unbelievable. Patient shocked that this information was not shared with her, that there were other options. Again, oral surgeon loses the case. Oral surgeon loses the money. Other orthodontist loses the patient. So in order to capture and retain the patient, withholding information. Pretty much unethical and pretty much a damn shame.